is Omri, the director of Elnet Israel. On behalf of the Elnet network, I'm more than happy to host you here. Our moderator today will be Yossi Abravanel. Yossi, if you can raise your hand so everybody can see you. We will address Yossi, the Deputy Executive Director from Elnet Israel. And we're going to have a few speakers today that Yossi will present.
Thank you for joining us for this special video conference on coronavirus for policymakers. When the world is fighting the same enemy, the same war, it is more than obvious that the more will be coordinated, the more we will collaborate between the countries at all levels, the more we'll have a chance to defeat or at least to contain this virus. We have actually about 90 people on this call from 16 different countries in Europe. Among the participants, we have members of the French National Assembly and the French Senate, members of the German National Parliament, the Bundestag, members of the European Parliament from Romania, Bulgaria, Greece, Italy, and Spain, members of the Polish Parliament, members of the Spanish Congress and Senate, members of the European Commission. We have mayors, we have health officials, we have diplomats, including 9 ambassadors from European countries. We have actually with us the ambassador of France, the ambassador of Poland, UK, Austria, Sweden, Spain, Denmark, Croatia, Finland. We have also the senior team of the European division of the Israeli MFA. Thank you all for being with us. It is also the time to thank our speakers. We have 3 speakers today. I will present them shortly. The first speaker is Professor Itamar Grotto. Professor Grotto is an epidemiologist and is serving as the Deputy Director General of the Ministry of Health of the State of Israel. And the second speaker is Professor Michal Linial. Professor Linial is a professor of biochemistry and bioinformatics at the Hebrew University of Jerusalem. And the third speaker is Mr. David Zigdon, the CEO of the Migal Research Center of the north of Israel. The Migal Research Center made recently a breakthrough in the process of finding a cure or a vaccine to the coronavirus, and we'll discuss this issue with him. So we will start now with the first speaker, Professor Itamar Grotto. You have 10 minutes for your speech, and then we'll have a Q&A session after that of 5 minutes with you. Can you tell us, please, Professor Grotto, what is the status actually in Israel regarding the virus? And please explain us also what is the strategy of the State of Israel in fighting this virus. Please, Professor, the floor is yours.
Okay, thank you very much, and for organizing this important meeting. I think we have a good chance of collaboration between countries which are struggling against the same disease and the same enemy with a lot of unknowns. And I think the most we share information is more possible for us to make progress in fighting this disease and lowering the number of severe cases and, of course, mortality. A little bit about the situation in Israel. Israel started having cases of coronavirus. Sorry. Started to have cases of coronavirus just a little bit later than other countries in Europe and the US, as well as countries, of course, in the Far East. And we believe this is due to very strict measures that were taken from banning and stopping the flights to China, and also people who came from China went into self-quarantine, and then we added more and more countries as the disease spread from the east to the west. And finally, we also got to a situation where we stopped all foreign travelers to come to Israel, as well as putting into 14 days of self-quarantine the people, Israeli citizens who came from abroad. So, this was the first measure that we took. This was to make these travel restrictions, which seems to be effective since there was a lack of the disease spread of, I can say, 2 or 3 weeks behind other countries, which are European countries, Central European countries, and Italy and France, Germany, etc. So this is one thing. The current situation is that we now have an increase, of course, increase in cases with the doubling time in cases of about 3 to 4 days. So this is the doubling time in the number of cases. And also we have about 2,500 cases, confirmed cases, with 41 patients in severe disease, which most of them require respiration, and 6 cases of death. So this is the current number. So it's relatively low, but it's still, I must say that it's going on with this is doubling time of 3-4 days, both for the cases as well as for the mortality. So we believe that the steps that have been taken so far has not made enough effect on the disease transmission, and we have to also take social distancing measures. The social distancing measures started to take place about 2 weeks ago with closing of schools closures, as well as kindergartens and and also universities. And this was actually the first measure, also limiting the number of people who were gathering to 5,000 cases, 5,000 people. About 2 to 3 days after, when we saw that the disease is still evolving, we also make more restrictions with closing of some of the not unnecessary services, not all of them, but some of the unnecessary services, including closings of malls and areas where people gathered. Of course, we stopped sports events in the beginning, all the theaters, etc. So this was the second phase. And in this second phase, we also limited the number of patients who can gather together to only 10 people, also with keeping the distance of 2 meters between one another. Now we are in the third phase of the, let's say, quarantine measures or restriction measures, in which we are more restricting. So only the pharmacies as well as food stores are open, and of course all the necessary services, including medical services, food supply, police, electricity, water, etc., which are essential for the Israeli infrastructure to keep on going. So this is also this is the current situation now. I must say that the compliance of the population is not enough to the measures. So also what we did in the last phase, which is the third phase, as I mentioned, is to also add, the criminal. It was regarded as criminal law to leave the home if you don't have good reason for this, and also the police is also enforcing this home quarantine for people who don't have necessary reason to leave their homes. So we believe this will be also have an effect on the compliance of the population with these restrictive measures. So we believe that this will have an effect, but unfortunately the effect will be seen only 10 to 14 days from now, because it takes time between the time that we take the measures and the time that we see effect on the disease spread and the epidemiological curve. So this is something that we have to be patient about, and sometimes the people, as well as the public, the press, and sometimes the politicians, are not patient enough to look for these steps to take time for them to interfere. But I believe that now we will have the effect, the relative effect on the mortality and of course morbidity in the next few days. So this is the main challenges that we are facing in terms of protective PPE, personal protective equipment for the medical staff. which we have some limited amounts, and we're also looking for a lot of new second challenge is the issue of laboratory exams. We have enlarged the capacity of the laboratories in Israel to more than 5,000 to 7,000 per day, but still we have some limitation in the swabs, but we're also working on it. Also, Israeli both home-based production, local production, as well as importation. And the third challenge is related to respirators, which we have relative large amount of respirators. We are free for the patients who are about to come, but still we are not sure that this will be able to cover all the and to handle all the patients that will be need respiration. So this we are working a lot, of course, on the supply chain to see that we can cover all the needs of the Israelis and the patients. So this is the current strategy for this. We believe that for the next 3 weeks, we will be very restrictive in the measures, and people will be stay at home. So this is the message. Also, working a lot of risk communication regarding the need to stay at home, and we hope that this will make an effect, that we can see a change and make the increase of the patient linear and not exponential. So this is actually the target, and then we are planning what will be the exit strategy after we finish this 3-4 weeks restrictive measures. Thank you.
Thank you, Professor Grotto. Now we will start the Q&A session. Can you hear me, first of all, because I have troubles with the connection? Do you hear? Okay, so we will start with the first question by the Italian MEP, Mr. Pietro Fiocchi. You have a question, I think.
Fantastic. Thank you very much for this opportunity. I have a few questions for the professor. Number one, herd immunity. Do you have studies related to the average age of the nation? Because if I understand well, on younger average age, the herd immunity concept is potentially good, but on a nation like Italy, which we have a very high average age, is not as good, because getting to the herd immunity concept would mean several deaths. Number two, do we have studies regarding latitude and temperature? If I understand well, the virus cannot infect as well with much warmer temperature. So the question is, if we manage with all the measures in Europe to decrease the infection rate in Europe, but then it starts again in the southern latitude and then it comes back, are we going to go through a cycle of many years of this virus going back and forth from the southern and the northern latitudes? Third question. The massive test approach by Korea, is that the answer? Is that the right approach?
Thank you for these important questions. Of course, this is all the time over discussion within the Ministry of Health, of course, also within the Israeli government. I try to understand the issue of the herd immunity, which means that maybe you let the young people be sick, and then this will protect the elderly. Although Israel is a relatively young country, there's still very high sensitivity for mortality among people who don't have any background diseases, which means I think the psychological effect of 1 or 2, 3, even 1 to 3 cases, which will be in young people, which can be without any background diseases, will make a big effect also on the acceptance of the Israeli society and the Israeli public regarding this herd immunity strategy. So I think this is relative now, currently not under consideration in Israel. So this is the first question. As for the temperature, actually, this we don't have an answer for this. We are hoping, of course, as everybody, let's say in the northern hemisphere, that the warming weather will have an effect on the disease spread. But I think and as far as I know, we don't have the right answer, and we hope that it will be have a positive effect on the stopping of the disease. And the last thing is related to the massive testing. So according to our policy in the Israeli Ministry of Health, we of course we're working to increase the laboratory capacity, but we don't believe that massive testing is a good answer or will solve the problem by itself. Because as we know, if someone is taking using the PCR technique, the RT-PCR technique, then of course you cannot identify. It's very relative to the time you took it. It means that if you have a negative result, then it could be be positive within 1, 2, 3 days, or even 2 hours. So it means that you cannot screen all the time all the population. So we believe this is not necessary, but we do think that massive testing is very important to monitor the spread of the disease. And we now planning to do some surveys, very quick surveys, and maybe make surveys on a daily or twice a day. Every 2 days to make a survey of the Israeli population to follow up the spread of the virus and to see the prevalence of the exposure in the population. One last step I want to relate to some of the new or more maybe the serological tests that we also got some to test in the laboratories in Israel, and we found out that we already tested about 8 different specific serological tests which can test IgG and IgM, and we have two things to say about it. First of all, until 14 days of disease, 14 days after the start of the disease, we see that most of them do not detect the antibodies. So this is not efficient in order to detect new cases. It means that incidence cases, but maybe it can be also used for surveys. But as far as the tested kits that we have tested, the sensitivity after 14 days is also relatively low, which is about 70 to 75%. So we also didn't find yet the test which will be good enough to also screen the population for possible exposure, and also to see that if someone is exposed, they have IgG, and then we can estimate the seroprevalence of the disease in the population. So this is what I have to say about the tests.
Thank you, Itamar. We will take last questions to Professor Grotto. I believe we have a question by the Spanish ambassador, Mr. Gomez Acebo. Can you unmute your microphone, please, and ask your question?
Until now, I think that each country has tried to build on its own experience and its own means in order to deal with a very important health crisis. Obviously, the crisis is global. What would be the advantages and the need from the Israeli perspective of a global cooperation? And I point out that only yesterday, our Minister of Foreign Affairs published an article in Washington Post calling for 4 strong measures in order to have a better and more efficient international cooperation in research, in economic reaction, and also in health, international health organizations, plus governance. Thanks.
I think the global perspective is very, very, very important. I also serve as a member of the executive board of the World Health Organization, and we also considering the global activities. And it seems that now, although there was, in the beginning, there was some kind of coordination with WHO, now it seems that every country takes its own measures, and I agree with you that we have to look for global strategy, and we should find some global body which can lead it. Of course, WHO can do it, but it's not enough to involve only the health sector, because it's also other aspects as well, economical and others. So I think this should be some kind of UN, or maybe UN-led or something like that could be lead this strategy. And I think this strategy should relate to a few aspects. Of course, research, as you mentioned, Mr. Ambassador, the research of new development, and also to estimate the efficacy of the different measures that have been taken in every country. So this is important, but I think it's more important to see that we also do some cooperation in the epidemiological levels that will be, let's say, if, for example, one country in each certain area will able to stop and to mitigate the spread of the disease and to mitigate the outbreak, then it could be that a neighboring country or country in different area will be able to let's say, to export new cases. So we, of course, in order to control this at the international level, we have to take some more coordinated activities. And I hope this could be start of a platform to do with this. Actually, we're discussing with different countries in certain levels, but of course there is no international collaboration outside of the WHO to deal in the level of the country leaders and the country presidents and prime ministers. So this should be also a message from here.
Thank you very much, Itamar. Thank you very much. I know we have a lot of questions. I see a lot of demands of questions of MPs and other participants. Unfortunately, we have to keep the time frame of this conference, so there will be another opportunity for question and answer after the brief of the two researchers. So we will go to the second part. And now, Professor Michal Linial, it is your turn to speak. We would like you to give us an overview of the research situation worldwide and in Israel, and to tell us upon your assessment which direction of research are more promising to arrive to a solution. Please, Professor Michal, the floor is yours.
Can you hear me okay?
Yes, we hear you well.
Yeah, great. So thank you very much, and thanks for everybody that joined. I think it's a really important event, and I think it's just a start, because we have to do more of this. So in order to make it also easier for you, I made a little bit of a presentation so you can share it later on with your colleagues and so on. This is the story. I mean, you see COVID-19, the SARS-2, and what I'd like to do is really to nail down in a few minutes what I believe are the most important aspects and where research should go. Now, I'm talking now not only from the Israeli point of view, but rather than as a scientist, because I believe all scientists are really one community where borders are not that important at that level. So what I want to show is, everybody knows this graph, I mean, unfortunately, and it's it's pretty shocking to think that it's only 2 months, this graph, that you see the peak of number of new cases per day. And we can see what happened in China in the left side of the graph, and now what's happened in the rest of the globe in the right side. And this blue line is just 1 month. So this is really, I think, tells the entire story of the epidemic that we are facing now. Now, in terms of numbers, I don't have to tell you that the entire world is there, with getting close to 500,000 people and over 21,000 deaths. Now, this is really the situation. I think these red dots all over the globe is what we see as of today, let's say, and probably it's going to be to keep going. Now, the most important, if I have to only say one slide, is this one, saying that the entire community is looking and trying to find what is common, what is different, what can we learn, and the only way to do it is share, share, and share. I mean, this is the most fundamental point that I want to say, that we have to share a lot of information. We cannot solve it. None of the countries can solve it by itself. At that point, as a researcher, the SARS-2 is really challenging the research community in a way that, you know, we never see, I never saw before. But everybody needs to remember that we know the virus for only 10 or maybe 12 weeks. And we try to know it, to nail it down, and to act without knowledge. This is against everything that we know how science is operating. First, you have to learn the material, then you have to build a design, and then to act. This is not the case here. So we have to act. Now, of course, there are short-term and long-term in terms of science, in terms of research. The detection and diagnosis are no question on the short-term and essential, and there is a lot of research on this direction. I'll say nothing about it unless you want to ask specific question. But what's on the table, and this is my own view as a scientist, what should be done, what are the most critical bottleneck to nail down scientifically research point of view the problem. First of all, we need to develop cellular models system for testing. Otherwise, a lot of excellent ideas will remain on the table. They will never get into testing. This is very fundamental. The second one is really to understand better the immune system. And when I say manipulating the immune system, is basically because we know nothing whether we have to activate it or should shut down, where to activate, when to shut down. So manipulation is just saying with no direction, but this is a very fundamental aspect. The third one is really the genetics. We are very proud to say that we know the human genome, which is 3 billion letters. This guy, the SARS-2, is 30,000 letters. Those 30,000 letters needs to be understood fundamentally. So I'll say a few words about this in a minute. Then we have to block viral entry, if possible. And the last one is systems biology. We have to get into druggable targets, trying to jump over the start of a very basic science, but do reuse of known targets if possible. Now, on detection and diagnosis, I won't say much because we know that a lot of things and very creative idea already implanted. Now, the challenges, again, are also in the clinical aspect. And here, I want to ask each and every one of you, we must clinically understand who is sensitive, and we have to have some way to connect to the EHR. I know the regulation, I know the issue of consent, I am very sensitive to this, but we have to do better on this. We have to improve. Can you hear me? Is it okay? Yeah, we have to improve and maybe relax some of those regulations in order to fight fast and effectively. On the other hand, we have to build a lot of prediction and modeling, but as you know, modeling can never be as good as what you put in the model. So unless we have good data, shared, common, high quality, the model will be useless. I'm a bit maybe exaggerating, but that's a message I want to convey. Now, vaccine development is very important, but I want to say that I believe there is no shortcut, and I'll tell you in one sentence why I believe as a researcher, as a scientist, why no shortcut on this level. It's because vaccines are to healthy people, not to sick people, and to many of them. So must be safety and effective of the vaccine must be checked very carefully. This is not to take light at all. Now, I want to take a few minutes to give you some of the example on the, for example, on the genetics, just as an example, how research can work. This is the air traffic. We understand what's going on here. Now, this is the kind of scientific view of what we are seeing. On the bottom part, you see the virus. And every peak, every line that you see is changing of the information of the viruses. Now, because the virus already infected at least 500,000 people, the resource of GISAID provided already 1,500 sequences, different sequences. Now, what you see in this graph are the evolvement of the virus within 2 months. In the middle is patient 1, patient 0. So you can see that there is a lot of information, but we have to connect it to data, to clinical information, to survival rate, to drug design, and so on and so forth. The last point that I want, not the last, but another point, very important, no research, major discipline will solve the crisis. We have to involve mathematicians, statistics, physics, chemistry, biologists, virologists, and so on, so forth. But we should not forget that physician and medical expert must be part of this team. And Israel is very good in it. And I want to suggest that some of the solutions that we are trying to solve are on this line. Now, we have one virus, we have one community, which is the research science community. We have to do unification of the research community. 2 examples are Elixir from Europe, which started 7 years ago, saying that we need to build a hub. We need to build a data sharing system. We have to use it. It's a must. In the US, similar effects are going on.
Professor Linial, you have to conclude because we have to keep the time frame.
Okay,
Please,
sure.
just a word of conclusion.
Sure. So I'll go to the conclusion. The conclusion is, I'll skip this. The conclusion is we have to use many different topics, and this is the summary. The summary is that by now there are 700 papers. Many of them are not reviewed yet. We have to do research, more research. We cannot do any shortcut. We have to change knowledge internationally, sharing data and cross-discipline, and we have to keep the highest scientific standard. This is just an Israeli that Professor Grotto showed us, a survey that is going on the internet for everybody to fill it once a day. This is already in use, and I think I'll stop here.
So now we'll go to the third part with our third speaker, but please, Professor Linial, stay online because we will have a question and answer session just after the third speaker. So the third speaker is Mr. David Zigdon from the Migal Research Center. The Migal Research Center already developed a vaccine for the chicken coronavirus. And we know that you are actually working on an application for humans. Can you tell us a little bit more about it and where you stand in this research? Please, David.
Thank you very much for having me today with you. If you can unmute also Professor Itamar and Itai Bloch so they can jump in when I ask them. A few words. Migal is a Applied Research Institute that we are located in the Upper Galilee. And we are affiliated with Tel Chai College, and we supported by Israeli Ministry of Science, and this research that we have done supported by Ministry of Agriculture. So I share with you a presentation and a little bit what we are doing. So in general, as we know, development, as my colleague said before, development of vaccine is challenge, and usually we are using mutation vaccine or inactive or killed vaccine, which a lot of trial and error involved there. So in about 4 years ago, Ministry of Agriculture challenged us with a center of knowledge, and they asked us to develop vaccine that if the virus will be changed, it will be a new variant of a virus, we can adjust the vaccine very, very fast. In order to do that, in Migal, about 5 groups of researchers join together to have a solution with few challenges that they have. First of all, should be adjust the vaccine very, very fast. It should be very, very cheap because for avian you need the cost of vaccine is cents, and the production should be very, very easy. So we combine a few groups, including immunology, microbiology, and computational chemistry, and enzyme evolution, and together, all these together, they have developed a system that can adjust very, very fast and adjust very, very fast. So what we have done, we move for trial and error to rational design of the vaccine. And I like to ask Itai to jump in and explain what we have done. Itai, please. Itai?
Can you hear me now?
Yeah.
Okay. So as David mentioned, our project was initially aimed towards developing avian vaccine for IBV, infectious bronchitis virus. It's a version or a family of a member of the corona family, which attacks birds in general. And we are actually relying on this group, this collaboration that we are doing in-house in Migal, between a group which has expertise in studying and understanding this virus, and therefore they could highlight specific antigenic or specific important elements within this virus, which are important in order to acquire or to give protective immune response. And during this research, we basically had to rationally select segments which will be presented to the body, to the human body, as a vaccine. And thereafter, they will cause the immune system to respond and to basically get a protective response for any encounter of the actual virus itself. So this type of virus is based on a relatively, I would say, a new technology. It's not like the common seasonal flu vaccine. We're talking about a subunit vaccine. It is given, it is basically composed of proteins per se. It doesn't have a full or any sort of a real virus in-house, but only really small segments of the entire virus. And it is given orally. So we had to design a system that can be administered orally, that is composed of several different elements from the virus itself. So we selected, based on prior knowledge and a lot of experience that the immunological group in Migal has, led by Professor Jacob Pitkovsky. And we selected two proteins which show that they can provide a very effective immune response. And in this case, it is important because this sort of proteins or this sort of approach actually activates two arms of the immune system that we have in our body. One is the standard the humoral immune response, which is basically antibodies which can recognize and neutralize viruses. And the other one is the cellular immune response, the one that is responsible of dissecting and presenting parts of the virus, and therefore activate the immune response, the immune cells against the virus itself. So David, can you move on? As I mentioned, we designed a construct, a protein after all, which is composed on the left-hand side of the presentation, you can see in blue and orange, which is basically composed of an antigen, which is part of the virus, of the, in this case, in the avian coronavirus. And these antigens are linked to a carrier protein, which knows how to help it get into the system, basically to pass through the tissues that it has to pass. On the right-hand side, you can see that because they are both the avian and the human coronavirus, they belong to the same family. So we could do the adjustment. We could identify the similar parts within the human coronavirus, which should be basically replaced on top of our original carrier. And now this is the adjustment that we are doing in order to adjust our vaccine, which was very effective in protecting chickens. And now we are doing that for humans. This is not the first time that vaccines are developed in this way. So going from veterinary use to actual human use. And maybe we can move on.
Thank you very much, but we have to conclude. If you want to give a few words of conclusion before we go to the Q&A session, I think there will be questions for you. So just give a conclusion and then we'll go to the questions.
Okay, about our vaccine, relatively, because we are not using the full virus, we are using only some protein, it's very, very safe. As the carrier protein of us, it's penetrate the mucosal system, so we give it orally, it's oral administration, it's not injection. So also, if you are not give something orally, it's safer than injection. And it's relatively fast adoption. So let's say that if there is a new variant of the corona vaccine in the next few years, we can adjust the vaccine very, very fast. Very, very fast. So this is for our conclusion, and we're happy to take your question.
So we have the first question by MP from the French National Assembly, Meir Habib. Meir, can you unmute your mic and ask the question?
Listen to me?
Yeah.
Hello?
I hear you. Hello.
Okay. Hello, everybody. Hello, Yossi. 3 short questions. I'm not a scientist. I'm a member of parliament. Unfortunately, we have up today 22 members of parliament who have been infected in France. And I'm afraid that the 500,000 in the world is underestimated, in my opinion. First question, what are specialists thinking about chloroquine of Professor Raoult? In France, we have a very, very strong discussion about the chloroquine, what they think about the chloroquine. Second question, unfortunately, we know a lot. I personally know around 100% infected. We have 3 possibilities: not be infected, infected asymptomatic, or infected ill. After how many days the asymptomatic people can go out? Everybody asks me this question. Is it after 40 days it's finished, or it's 3 weeks, 4 months, 1 month, or more? Second question. Last question, and I'll try to be short. According to specialists, we see that in China it seems over. What the date, pessimist and optimist to the end of the virus in the world? We have a date? We cannot have date. 4 weeks, 2 weeks, 2 months. Thank you very much. I'll try to be short.
So for the first question, first of all, thank you for those very important questions that bothers everybody. So for the chloroquine story, of course, we know very much that it was in the news and Trump and so on. It's very important to know that the initial support was based on 36 patients in which they were not double-blinded, in which some of them were getting out of the system. So statistically, it was very suggestive, but far, far from conclusive. So now it's very important that immediately there were a few hundreds of tests to really make it solid. So there is as of now, there is no result besides saying that the initial one was very shaky, only indicative for something that's worth exploring. That's for the first question. The second one is very important. Again, I'm not a physician, but I read quite a lot. And today there was a very important paper in the bioarchive that I suggest, mainly for the policy people around you. analyzed 1,500 people with all the numbers of how long does it take if you are young, if you are asymptomatic, symptomatic, if you have severe disease, and so on. All those numbers are very detailed. I suggest, and if you want, after this talk, I'll add a link to this paper that I think it's worth reading. So that was the second, and for the third one, which is what will be, in the future, I'm not I can only say that I don't think it's going very fast. I think the coming 6 weeks will be as hard as today, really for us. I haven't seen my kids for a month and so on. So what I'm saying is that we have to be, in my view, this is really personal, very, very strict in order to make clever release of this idea. And I'm sure that we'll have to live with it, like we live with it. Remember that this is the first time that humanity have seen this virus. This is not like a flu, that for 100 years we see it, and we have a residual protection.
Thank you, Professor Linial. We have now one question for the Migal Research Center by the UK Embassy. Can you ask your question, Lara Kranzenstein? Please unmute her.
Yeah, hi. I just wanted to know from the Migal group, is there anything we can offer from the international community to help move things along? Is there anything they need for their research? That's what we're here to do, to help.
We get a lot of people that try to help us, and we really appreciate. Now we are in the process of producing the human protein. As Itai said, we already moved from avian vaccine to human vaccine. We are looking for a production facility, GMP for production facility, and we have started to talk with the regulation body in each country. We like to speak with them regarding the need to go to first in human, and we get, in general, we know that they reduce a lot of the preclinical trial that we have to do, but still we like to have to present our plan and get feedback about this regarding the human first in human study.
Thank you very much, David. We have a new question by MP Thierry Michels from the French National Assembly. Please, MP Michel, ask your question.
Yeah, thank you. Thank you for setting up this meeting. Hello, everybody. I think you already asked the answer that my colleague May Habib on the chloroquine, but are there other, drugs that could be used, that exist, which are the ones which are currently being tested? Thank you.
I'm not a clinician, but I was expecting such a question, so I tried to read everything that is known. So basically, we are in early days, really. I mean, it's very hard to say it loud, but I was consulting with really physicians that to have maybe a more positive reply. As you know, there is this quite promising Japanese kind of the Fuji new drug that was in the news for the last few days. Again, it was tested on 340 people, so the numbers is reasonably okay. From Yuan, China, there is another one of Gilead, as you know, and this is, to the best of my knowledge, the third with the chloroquine, I would say top in the top of the list. There are by now 86 clinical trials for different drugs. So again, if needed, I can share with you the most updated one, which is 3 days ago.
Thank you very much, Professor Linial. I believe we have a question by the Croatian ambassador, Mrs. Kovac. Can you ask your question?
Now unmuted. Okay. Good afternoon to everyone. Just in continuation to the UK colleagues, what would be the way, who would be your partners that you are looking right now that we can transfer the message to our capitals, and also if you would be ready to share the presentations that you showed to us. Thank you.
First of all, yeah, we happy to share the presentation, no problem. We are in the process of raising capital. Of course, we are a research institute, non-profit research institute. We license this technology to company that we just established looking for money. Partner that we are looking is, as I said, we are looking for GMP manufacturer that can do fermentation, protein fermentation that has all the skill of testing this protein. We like to jump very, very fast. And the other one, as I said, it's connection to the regulatory body in your country that can give us a feedback regarding the first in human trial that we can do and where we can do it.
Thank you very much. We will take a last questions before the conclusion by MDB, member of the German Bundestag Parliament, Nezat Baradari. So please ask your question. You should be unmute right now.
Okay. Thank you very much for the argumentations. My question is, children can tolerate immunization better than adults. Is it true that children can survive this infection better than adults? And what can be a specific reason of this situation? Thank you.
There are several theories about it. One of the theory has to do with the abundance of the ACE2 receptors on surfaces on mucosal. We are not sure that that's the right answer. It's unusual to see that because, for example, in influenza, it's the other way around. The two ages of age, like the very young and the very old, are the most susceptible ones. There are things to be learned. I don't think that we are really there now at this point. I think that data should be accumulated, research should be done. I don't think that we really have a good answer to this question.
Okay, thank you very much, Professor Shalit. We would like to give a last word of conclusion to Mr. David Zigdon, the president of Felnet. Please, David.
Thank you, Yossi, and we want to thank you on behalf of Elnet for participating in this call. We know that these are very difficult times for all of us, for you and for your families and your countries and communities, and we deeply appreciate you being on this call. We had, by my count, 91 participants on this call today. It's a first, so please see yourselves as founding members of this network's community, online community. We had over 60 officials with us, 27 MPs, other senior officials, mayors, EU officials, and so on. You already heard the list, and we're very gratified about this. What we'd like to do is more of these with you, because the goal of Elnet, of course, is to build bridges between Europe and Israel. And you've heard about the need for collaboration today, both from the scientists and from the Israeli officials, and of course from your side in Europe. So we need to find better ways to collaborate and to help scientists and companies come together. And that's the goal that we have adopted for the coming months. So within, I hope, the next 10 days, we'll have a second round. Please send us your feedback. If you have ideas about European officials, scientists that you think should be on this call with us to speak or to participate, please let us know. But in the meanwhile, again, in the meantime, we want to thank all of you, including the Israeli officials that are on this call, and certainly our European friends. Please stay part of our network. We want to do much more, and we can do much more online together with you. So let's all think together about how to make this forum the strongest it could be, and we'll see you again, we hope, in the next 10 days or so. Thank you very much. And thank you, Yossi, and thank you to our team in Elnet.
Thank you all.